So here is a superior view of the rib cage. So basically we're looking from this human from the top, and we cut it and we look from the top and we remove all the muscles. I'm just trying to show you how the serratus anterior muscle attaches to the scapula. So this here it would be the sternum, this is the thoracic vertebra, and the rib, costal cartilage, and the bony portion of the rib continues backwards and attaches to the vertebral bone. And this here, this is the scapula. So there's one and there's another one. I just tried to show the scapular spine on the back of it. And this is the head of the humerus. Normally it would attach the scapula, but I have shown it a little further just to simplify things and make it more clear. So we have the humerus, scapula, ribs, costal cartilage, sternum, vertebra. Now, the serratus, first we'll look at the subscapularis muscle of the scapula. So the subscapularis muscle comes from this portion here, from the subscapular fossa on the anterior aspect of the scapula, and it goes and attaches to the humerus. Okay, so that is your subscapularis muscle here, and one will go and attach here. So it comes from the anterior surface of the scapula. Now the serratus anterior muscle here, coming from the rib, continues posteriorly along the surface of the rib and attaches here along the medial edge of the scapula on the anterior surface, not on the back but anterior surface. Okay, so there is your serratus anterior muscle here, and also the same thing coming along the ribs and attaching here along this medial border of the rib, the scapula. So as you can see, normally the scapula would be not so far from the rib cage, it would be leaning on the rib cage, so you can think of the serratus anterior muscle and the being in contact with the subscapularis muscle. This is the superior view of the chest, and these muscles are called the intercostal muscles. There's 3 layers of intercostal muscles, and intercostal muscles means that they're located within the intercostal space between ribs. So there's rib above these muscles and below these muscles, and these muscles help attach those ribs together and therefore are involved in breathing. So the intercostal muscle consists of 3 layers. The outermost is the external intercostal, the middle is the internal intercostal, and the innermost is called consists of 3 parts. There's the transverse thoracis, innermost intercostal, and subcostal. Of these 3, the innermost intercostal is most important. So you have external intercostal, internal intercostal, and innermost intercostal. Next, you should also notice that the external intercostal, so this is the vertebral column and there's a spinal cord. The external intercostal, as it comes anteriorly to attach to the sternum, the muscle is here. But as you can see, when it comes close to the sternum, it thins, it becomes thin, and it is no longer a muscle but a membrane, and this is called the external intercostal membrane. So the muscle of the external intercostal ends in this area and then continues as a thin membrane to attach to the sternum. Okay, so it's not it doesn't attach to the sternum directly, it stops and then a thin membrane called external intercostal membrane attached to the sternum. It's somewhat see-through, so from here you can actually even see the muscle of the internal intercostal. The internal intercostal attaches directly to the sternum, but as it goes posteriorly to attach to the structures on the back, it will end here and an internal intercostal membrane will continue.